Good afternoon and welcome to another intriguing episode of Health Check here on Voice of the People Television. I am your host, Bryce Peters, and it is always a delight to bring you amazing, beautiful conversations centered around your well-being. Your health is our priority here. And yeah, we're here again today to talk about another interesting topic. Well, today's conversation is a very sensitive one, but very necessary. Over the past few weeks and even over the years, there has been a very significant complaint in the health sector. Nigeria has been flooded with heartbreaking stories from hospitals, stories that have reopened a long-standing conversation about patient safety, medical negligence, and the state of our healthcare system. Really, we've heard stories like that of renowned author Chimamanda Ngozi Adichie, whose 21-month-old son reportedly died after the family alleged that he was denied oxygen and excessively sedated in a private hospital, which led to a cardiac arrest in that little boy. That's actually very sad. We also heard of stories like that of Aisha Umar in Kano, whose family says a pair of surgical scissors was left inside her body during an operation, causing months of severe pain before she eventually died. That's not even all. We've heard stories like that of Ifunanya, the young singer who died after being beaten by a snake in Abuja. We heard that she was first taken to a clinic without antivenom and then transferred to a hospital where questions were raised about access to complete life-saving treatments. All of these are quite sad. These and many more that we really don't even know about. Beyond these high-profile cases, thousands and thousands of everyday Nigerians are also sharing their own painful experiences of waiting endlessly in emergency units, being told that there is only one doctor on duty or sometimes no doctor available. All of these has left many people asking, what is really going on in our hospitals? Why does seeking medical care increasingly feel like a gamble? Well, it's getting very emotional over here, but I'm not alone. So to help us unpack this in a very balanced, emphasis on balanced, honest and human way, I'm joined by Dr. Charles Adeogun. He's a wellness physician and public health advocate. Dr. Charles, you're very welcome to Health Check.
Thank you for having me. Good afternoon.
It's amazing to have you on the show today.
Same here. Happy New Year.
All right. See you. That's true. This is the first time I'm seeing you on the show this year. All right. So, Doctor, we have a very pressing issue on ground. I don't want to call it medical negligence, but I guess we just have to use that phrase. People often think that doctors are emotionally shielded from these stories. We feel like, okay, doctors have seen so many death cases. They've become immune to it. As much as people get affected and all that, we're like, doctors, do they even really care about us? Sometimes we even get to the clinic and they don't attend to us very well. And we are like, why are you people treating us like this? So we often feel like doctors are emotionally shielded from stories like this. But when you hear cases like this, I want to ask you now, personally, because you are a doctor. So how does it affect you personally when you hear stories like this?
So first and foremost, I want to clarify that doctors are human, though they are professionals that are trained to save lives, but to a very large extent, they also have emotions. In as much as you try as much as possible to give quality healthcare delivery, and you want to do that with clarity, empathy, and everything done professionally, you still have your emotions. So most doctors have what we call a kind of professional approach to managing patients, when they present at the hospital. Death is a reality to humanity that is never, a very good experience. So the process of grief, associated with bereavements, mourning period, people experiencing depression and all that. It's absolutely normal, and doctors too have their fair share of it. The fact that you're not related to somebody doesn't mean that when you lose a patient that you don't feel grief as well, but you just have to manage it in a way that you don't let it make you dysfunctional. But that still differs from person to person because doctors too have their individual traits, basically. But for me as a person, I would say that these incidences that you have cited are quite unfortunate and it should not be in an ideal setting. There are lots of things that, are plaguing our health system that is resulting in all this kind of consequences we're experiencing. First and foremost, I must, highlight the fact that a lot of doctors in Nigeria are overworked. So the burden of work, even the statistics will tell you that the ratio of doctor to the general population is,
Yeah.
and you know about the brain drain thing, about how much of people are presenting at the hospital now. We have a lot of people who are ill presently in the country for various ailments. And the number of professionals that are available to cater to their health needs are minimal. So, of course, you find out that there will be overwhelming consultations for doctors. There will be a lot of, a high likelihood of mismanagement of data. There may also be cases where, you have oversights, and those oversights can really be detrimental at the end of the day because, unfortunately, any errors would always bounce back on patients.
Yeah.
So this is where we would now say, the working conditions of doctors, must be improved.
Yeah.
You would need more well-trained doctors. You will make sure that the working conditions are favorable. You will make sure that the remunerations, are good enough to make sure that the doctors stay motivated to give their best at their jobs.
Yeah.
Because a doctor who is thinking of so many things and is just coming to work bothered about a lot of things, is anxious about rising cost of rent or transportation or school fees or all the things he still needs to meet up with, and he's still looking for, a means to make ends meet by juggling jobs and all that. You can't have that doctor deliver 100% of his capacity. And the oversights and the errors and the mistakes would drop on the table of the patient eventually. And everybody that is involved in the healthcare delivery chain is not immune to this. Even the nurses, the laboratory scientists, the pharmacists, it's a team. The medical team, it's a team of professionals coming together to deliver healthcare. So basically, every one of them are stretched. And this can cause all these problems that we're seeing. It is easy for you to make errors when you're not focused. It is easy for you to make errors when you're not motivated. It is easy for you to make errors when the working conditions are not favorable. So I think those are the few things that could possibly be responsible for these things that the government and health policy and possibly budget allotments, can actually help to correct.
Well, that's quite sad because at the end of the day, the patients get to suffer for this.
Absolutely.
Meanwhile, from your experience, are we really dealing with careless individuals, or it's just the system that is deeply strained and unsafe?
Well, I think there are possibly a number of answers to that. Yes, the system is strained and overburdened. And secondly, you also have a situation where, unfortunately, people bring in their personal traits from their daily lives and routines into their professional life.
Exactly.
So you find out that a lot of Nigerians don't pay attention to details naturally. True.
I love the fact that now we are stating facts.
That is the truth. A lot
Yes.
of Nigerians don't pay attention to details.
I don't understand why you would forget surgical scissors in a womb.
That is why precautions, there are safety measures that should be.
And scissors that tiny.
And you would also have theater nurses. You have your surgical team with you.
So nobody noticed that.
Exactly. So even if it was an error from one person, there should be somebody who, you know, a
And then you
theater
stitch the
nurse,
person back.
you know, yeah, you know, that would verify that everything that you used, you know, everything is complete before you close the patient back. And you should always recheck and verify that you are good to go to end the surgery. So
Exactly.
I think
I
we
don't
don't.
really want to believe that it is just the system that is failed. I feel like individuals also have a
No,
role to
that's
play
why I
in
said
this.
we have multiple answers to this. So you
Yeah,
actually find out that people bring in their personal traits to the job. We as a people need to do more in paying attention to details, in doing due diligence to important things.
yeah,
And then focus and concentration on the job is key, particularly in healthcare delivery, because the slightest error could mean a life is gone.
yeah.
You know, and you know, for a lot of people, we find out that even in everyday life, you ask somebody for something, or you give somebody an information, and then in 5 minutes you ask, or 10 minutes you ask the person,
You
the
forgot
person
it.
just, and the person was probably nodding when you were telling the information. You probably think the person got you right, but at the end of the day, the person will do the exact opposite of what you asked him to do.
That's very
You
correct.
know, and you'll be wondering, but you signaled to me that you understood what I said in the first instance. That tells you the attention span. That
Fine.
tells you the level of focus and commitment that people have in their daily lives for ordinary things. But that has now, you know, come into the professional scene, and it is now translating into what we're seeing as negligence on the job.
That's quite sad, you know. But still talking about medical negligence, I don't really want to believe that this one is medical negligence anyway. I want to believe this is the system. So I heard of a case scenario where a hospital where a single doctor was expected to cover an entire emergency unit. I mean, one doctor. In fact, I don't want to say this all by myself. Let's take a look at a short video shared by an investigator showing a general hospital in Ogun State where only one doctor was assigned and dozens of patients were waiting, and the doctor had not resumed duty at the time. Please, let's have the video.
Can you see a lot of people waiting for a doctor here? Lọ fà ọ́. Ẹ̀gbọ́n, má bínú. Ẹ jọ̀ọ́, ṣé dókítà ni gbogbo àtàwọn bíbá náà ń dúró dé? Lọ fà ọ́. Ẹ ṣàì má bínú. Ẹ jọ̀ọ́, àwọn tá a jókòó iná dókítà ni à ń dúró dé. Wọn ò lè ti dì, àwọn èèyàn sì tún wà ń ta gan tó ń dúró de dókítà tó ń pọ̀ gan.
We can see that was a really that's really sad. Okay, I don't want to speak from emotions here, but I feel like that was a really sad one. So watching that, doctor, how dangerous is this kind of situation for patients? I can't imagine anybody in the emergency, you know, room there. What would they be feeling like? They'll just feel like life is gone for them. I don't want to imagine. So how dangerous is this for the doctor as well?
So when you call something an emergency, it means time is of the essence. And that means that you need urgent care. So when you see an emergency room crowded and there is no doctor to attend to them, it just simply tells you that you don't even know how serious some of these conditions are, and you don't even know if some of them can even make it till when the doctor arrives.
Exactly.
So it is so sad that we have scarcity of health workers, and it is still around brain drain. It is still around having fewer trained doctors, you know. And then also it is also from doctors feeling that they are not motivated enough. And mind you, the shortage of doctors, to a large extent, brain drain contributes. But for some other people, it's not only brain drain. Some doctors are in the country, but they've diversified into other fields or other sectors. And we need to look for reasons why the passion they once had for their profession is no longer there. And it will all come back to motivation, remuneration, you know, the sense of fulfillment they get from their job. You see, job satisfaction
the sense of fulfillment.
Yes, job satisfaction goes a long way in determining the performance of professionals. So the government has a long way to go in trying to let doctors know that they are appreciated, that their work is seen, that their work is appreciated, and that should reflect in their working conditions. Because as a professional, you can't be working in a health facility and you don't have basic water or soap or disinfectants that you need, or even disposable consumables, gloves, and all that. You don't have them at your disposal. That's really something of concern, because you as a health professional, in as much as you're trying to save a life, you don't also want to catch infections, and you don't want to spread one infection from one patient to another patient. So you can imagine if these things are still, basic stuff are still problems in our society. It really is sad in this day and age. So we have a lot to do in terms of making sure that the good working condition, better working conditions are put in place for doctors, better remuneration are put in place for doctors, and let doctors have a sense of worth, knowing that they are well appreciated, so that they can have self-actualization. Because nobody wants to go through years of rigorous training to save lives.
I even feel like this profession has to do with purpose. If you
course.
don't feel like you are, giving some level of sacrifice, you would feel used.
Yes, of course, because it looks like you're giving away. You're just
Not prioritizing your own self.
Yes,
too.
you're giving your life away to an extent,
Yeah.
and to a good cause at that. But you also are looking forward to some form of
Compensation,
that is worth your
fulfillment.
while. That is
Exactly.
worth your while and meaningful. That will keep you motivated to keep doing your best. But unfortunately, if these needs are not met or these things are left unchecked, you cannot get the best out of these professionals. And sadly, those people in those emergency rooms, it looks like the country has failed them, because we are the ones advocating for, please don't self-medicate. We are the ones advocating for, don't use these mixtures that you don't know what the contents are. But when they are
Sometimes they
left
are
helpless,
forced
yes,
to.
but when they are left helpless, they will look for other means available to them
That's
to
very
get
true.
themselves treated. And unfortunately, they may even run into bigger problems. So it's very essential that we need to really, address this issue.
I can't even imagine what could be going on with that particular doctor that has to oversee that much
because
people.
that doctor
He has a family
that
too.
doctor is also overwhelmed, because
Honestly,
that
how
doctor
would he do it?
he may have been on 24-hour shifts, night shifts.
I'm not even sure that doctor himself is fine.
Exactly, because he may also be completely drained, exhausted,
Exactly.
and needs to be refreshed himself. How can you be in that state of mind or state of physical, that physical state, and be able to deliver appropriately?
How did we
Because
get
even
here?
your sense of decision making, or your ability to diagnose appropriately or give proper counseling to a patient. You can't counsel somebody when you yourself need counseling. And then you can't help other people when you yourself are in need of help. No, but that is the
Okay,
truth.
that's profound. Okay, so I want to quickly touch on something that has even been bothering me myself. There is this comparison between private hospitals being safer than public hospitals, but I've also seen that public hospitals tend to have better equipped staff, more professionals and all that. So we don't even know exactly which is even safer when it comes to things like delivery and all of that. People just always feel like which is better and all that because of the kind of things we have seen in this particular, sector. So based on reality, would you suggest, or what would you say about this? Is patient safety really about ownership, or is it about standard? Is it about staffing, or is it about the systems?
All of the above. It's about standards, it's about quality control, it's about making sure that the kind of healthcare delivery or the kind of clinical setting that you have delivers optimal care for the patient, prioritizing the needs of the patient, to make sure that everything that is around healthcare delivery and everybody on your health team, are well positioned to carry out their duties diligently. The problem with most of the government hospitals that people say is long waiting times before you get an appointment, before a doctor gets to see you, the crowd and all that, which is of course expected. But if we still address this scarcity of doctors, or improve on the number of doctors we have, trained health professionals we have, I think this to a large extent will be reduced. And the advantage of private settings, people say, oh, you go there promptly, you can see a doctor, things work faster. Yes, things work faster, but nowadays you also find out that all sorts of things are happening. You also have some so-called private settings that the
Ends up
certifications,
being quacks.
the certifications or the licenses of people who claim to be, manning the facility, are in question. And then you may not be able to know who you are actually, sitting in front of, whether the person can make or mar your situation. So
Yes.
basically, it's always advisable that at least you know the quality of the professionals that you're seeing. At least you get that in the government hospitals. The government hospitals, you have your specialists, you have your trained doctors, know that there's a lot of
Exactly.
verification that
Yes.
goes into play, in that kind of setting,
Yes.
Taking out the waiting times and other issues, the hitches that they also experience.
Yeah.
But in the private setting, yes, you can have prompt service. Yes, you can have quick service delivery. But what is the quality of that
The
service
quality,
delivery?
now
And
that
then, and
is
then
it.
who? And then I know we have regulatory agencies that go around to make sure that these facilities are, they are up to date, and then they have the right professionals and all that. But we still know that sometimes some of these people escape the radar sometimes.
Yeah, that's very
So
correct.
so it's still very difficult because you still are not sure absolutely who you're seeing, and that puts a lot of things to question. So it's very important that you as a patient, you are also well informed. Gone are the days where ignorance is, well, I'm not a medical person, I don't need to know so much. That's why I'm going to the hospital. But you should know about your health.
Yes, ignorance is
So,
no longer an
yeah,
excuse.
it's no longer an excuse because you should be able to ask questions. And when concerns arise in terms of you asking a question and you're not getting answers that are satisfactory to you, or you think that the person you're talking to, the professional you're talking to, you don't get the right vibes that the person is on top of his game when it comes to managing a case like this, then you better go elsewhere, because this is your health here, and
It's your
any
life.
error can
Falls
just take
back
your
on
life.
you.
Yes, any error takes your life away from you, or permanent incapacitation, as the case may be.
Yeah.
So it's very necessary that you have good conversations with your health professionals. Make sure that you ask relevant questions concerning matters of your health, concerning your diagnosis, concerning your line of management, and ask, why are we doing this, or what is the relevance of this? And you need to know and be assured and be fully convinced that the person you are placing your life in his hands is capable of helping you.
Yeah. Ask questions. Ask questions and be very, very sure. So right about now, we'll be going on a very short break. And when we return, we'll talk about the effects of all of these in families, basically touching the emotional part of this particular conversation. Well, please stay tuned. We'll be right back. Okay, welcome back. This is still Health Check on Voice of the People television. And we're still talking about, patient safety, medical negligence, how to improve all of these. And right about now, we're talking about the families, right, Dr. Degon? So we understand that behind every case is a family. Chimamanda lost a son. Aisha Umar's children lost their mother. Ifunanya's friend lost a rising star. When families feel ignored, they feel confused or left without answers, what does this do to trust in the healthcare? So these people might have developed some kind of fear or some kind of, they feel destabilized, literally. So what would you say concerning that to help build their trust back in the health sector?
Well, like we said earlier, they are humans, just like doctors are humans too.
Yeah.
So emotions would come to play. And bereavement is never easy. There's a grieving process. And of course, there will be some degree of loss of trust in the system, loss of credibility in of the system. And then you would also find a lot of people asking questions, where do we go from here? So when
Yeah.
people are ill, so where do we turn to? So do we even stand a chance? So anybody who is ill now is sentenced to die. All these kind of questions would arise in the minds of people. And that is absolutely normal. For us to actually build back the trust and let people know that, okay, we still can do better, we have what it takes to be better, we need the whole medical system and even the government's backing to be able to achieve this. So this is not something a particular sector alone can handle. The doctors must be more diligent on their jobs. The nurses, who are also a substantial part of the health team, must also minimize errors, when it comes to their jobs, paying more attention to details, making sure that they verify things and nothing is put to chance, nothing is left to chance. And then ultimately, even the people who produce results, the lab results and the diagnostics, very, very essential. So any errors from them also, to a large extent, may also misdirect the doctor's judgment.
Yes.
Misdirect the doctor's management. So
Yes.
everybody, all hands must be on deck. And finally, the pharmacists too, who eventually would dispense these medications, must make sure that the right medications are given out at the right doses and for the right duration of time. All these things, you can see that everybody has their own functional roles, and
Yeah.
each of those roles are very essential in maintaining, quality healthcare delivery. And of course, the governments have their own role in ensuring that everything these professionals need to be in place to be able to, give their best at their job and to function optimally and made available to them. Because if these things are not available to them, we'll still be dancing around in circles, and we're not going to be able to get where we want to get to. And if you have more people losing faith in the system, all you have is more people going back to self-medication, which you're discouraging, more people going into alternative medicine or into unverifiable forms of treatments that are available to them, which we know will be catastrophic in the end, because the consequences of that would really boomerang on everyone, because you will now find new illnesses coming out. You find people with organ failures that you can't explain because they are looking for other sources of care outside conventional care. So it's very essential that the government looks into this with a matter of urgency, knowing that we need to salvage the health system. And one of the simplest ways to salvage the health system is from your budget allocation, prioritize health. Very essential. You have to
About that.
prioritize health. Health must carry huge priority, in the government's plan. Because without that, we're not going to see improvements. Because that is what would help refurbish the existing health facilities. This is what will help maintain all the equipment that we use for our diagnostics. This is what will ensure that doctors and healthcare remuneration is there as at when due. And we don't want to hear all this strike back and forth thing. Yes, because all these things come from job dissatisfaction.
Exactly.
Because it is when you have problems with your job, that's when you think you want to protest, that's when you think of strike. But if doctors are happy, at their stations, nobody will think of strike. Everybody will be looking at how to improve the system. Everybody will give their best, and everybody would reap the dividends of this. So the government has a huge role to play. The Ministry of Health, and the commissioners of health for the different states, they really have a huge role to play in seeing to it that, doctors and healthcare professionals in general, are comfortable on their jobs, because what they do is too delicate. What they do is too important to be toyed with, because the consequences are grave. We need to do better.
Yeah, we heard. I think it's even very trending now. The massive migration of Nigerian doctors and health workers to other countries. At the same time, we are seeing industrial actions and strike threats within the health sector. From your perspective, how do you think this is really affecting the patient's life? How does labor unrest connect to patient safety, and what can be done about it? In terms of the doctors, I feel like they should also consider the patient sometimes, knowing that the government can be very, slow in the response of this. Yeah. So if they keep going at this rate, don't you think that we'll be losing more lives to, this whole thing?
The truth of the matter is that a lot of doctors are already sacrificial, to be honest. A lot of them are sacrificial, especially in the government facilities. We've heard of doctors who personally use their money to buy certain things for the patients. Yes, correct.
Wow.
Some of the things that are not available, they go out of their way to source for funds for these things to make things work. So you cannot expect professionals who are salary earners also, who have their own private responsibilities and personal life, to keep doing that for every patient they encounter. That is not sustainable. So you are already now making them, work in a condition that is not so favorable, that is not so conducive, and yet with all the sacrifices, it looks like things still remain the same. And it's not sustainable for them even emotionally and, physically as well, because they're exhausted and drained, or in all ramifications. So you cannot expect that kind of a person to be able to give his best. And it may sound a bit insensitive that doctors will go on strike when people are ill in the hospital, but the truth of the matter is the doctor also has a family. And one thing I keep telling people is that we as Nigerians should appreciate doctors more. I'm not saying this out of sentiment or because I'm a doctor. I'm just being realistic. Because the truth of the matter is somebody who is there to help you, who is there to save your life. A lot of Nigerians take doctors for granted a lot. You find people, they just see you as a solution to their problems. But how many of them actually give back? Anybody who is watering should also be watered back.
Sure.
That is the only way. You cannot pour from an empty cup. So you cannot expect somebody to keep giving and giving and not being watered in return. You're going to drain the person out. In fact, you're going to wipe out the person's existence. So a lot of Nigerians will call you out of the blues. Oh, doctor, we need this. Doctor, we need that. They expect you to be there for them. They expect you to give them timely advice. They expect you to give them prescriptions. They see you at the church. They want you to help them. They see you at the restaurant. Everywhere you appear, you are a solution to somebody's problem. But how many people actually do come back to you to show appreciation to you for what you do?
True.
Very, very few of them.
Very few.
So you're actually seen as somebody who is an answer to all,
Savior.
but nobody is ever a solution to your own matter, and to now make it all worse, even your remuneration or what you expect from the government is not forthcoming either. I think it's quite a frustrating situation.
Yeah.
So you are just seen as somebody who keeps giving and giving and giving, and you're giving a lot because your work is physically tasking, emotionally tasking, mentally draining, and you are not watered back the way you're supposed to be watered, and yet people have high expectations of you. I don't think that's feasible and sustainable. We need to do better if we really want to see an improvement.
Yeah, we really need to do better. But, let's talk about the practical steps towards this now. So I know we've stated the policies and all of that, but let's say you have 5 minutes, to have the ears of the policymakers in the country. What immediate changes, emphasis on immediate changes, would you push for to reduce, the preventable deaths and even all of this? And also, let's talk about the policy management, even in the hospital. I mean, with the management of the hospitals and all of that. What role do you think hospital management should play in building safer systems as well?
So hospital management can start with being, very, very strict with their recruitment, making sure that the people you bring on board are people who know their onions, who are well experienced, and who are good on their jobs. Not only are they good on their jobs, they are also dynamic and teachable and adaptable. They are ready to learn more. And because medicine is dynamic, nobody ever says, I'm a health professional, I know it all, I don't need to learn anything. New things are coming up, new lines of management, new medications are coming up. You need to keep improving on yourself. So the clinical management of any facility must ensure that every member of the health team, they are also evolving, they are getting better. They are getting proper, advancement in what they know. And they're going for updates, courses, conferences, seminars. They're doing their own research. They're open to, learning more and broadening their scope and improving their clinical skills. That is the only way. And anybody you find wanting is either you do away with them or you ask them, look, you need to brush up. You need to be better if you want to stay in this institution, and you stand by it so that your institution is known for standard. And you are known that you give best quality, best global practices, because there's a certain level of expectation for good quality hospitals. And on the part of policymakers must do better in enacting laws and regulations that will protect the working conditions of doctors, making sure that health budget allotments of the budget to health is prioritized. You have a good substantial amount of the percentage of the budget going to health and health infrastructures, making sure that doctors' remuneration, is timely, no stories, and something comparable to what you get in other climes. If you really want to combat brain drain,
Yeah.
then
Or else everybody will leave us here.
absolutely. And then also, you may also need to set up agencies and have laws and regulations that look into malpractice, and there should be consequences for, for wrong management, particularly when you've done your due diligence in carrying out investigations and you actually find out that it was a case of negligence, it was a case of malpractice. Then there should be consequences. There should be strict laws and regulations that apply to health professionals who, have been found to be negligent. All you need is just a few scapegoats, and I think every other person will comply.
A few scapegoats. I can tell you're a disciplined person. Okay. All right. So this message is to the policymakers, even in the hospital sector, the medical sector, and even in the country as well. Well, before we wrap up this week's episode, I'd like to acknowledge the fact that this week marked World Cancer Day. I think that was February 4th, and we've had in-depth cancer conversations on this program before, actually. But today, we simply want to just acknowledge everyone living with cancer, those undergoing treatment, and families walking through that journey. It's definitely going to get better. But doctor, in a few words, what message of encouragement do you have for cancer patients and people with tendencies, of having this particular ailment?
So cancer is a global menace that has affected humanity, and there's a lot of research ongoing into the treatment and management of cancer. There are some cancer survivors, so that is one positive outlook to it. So anybody living with cancer now who has just gotten a diagnosis of cancer should know that there's hope. But we need to emphasize on early intervention, because like we always say, early intervention would always produce better outcomes. So when the cancer is still starting before there is a widespread to other organs or distant organs, the prognosis is usually better. So we advise everybody, go for your screenings. For the women, go for your breast ultrasound scan. If you're above 40, go for your mammograms, do your cervical pap smear screening for cervical cancer. If you're over 50, you should go for your colonoscopy to rule out colorectal cancer. For the men, after the age of 40, please, it is mandatory for you to have your PSAs check. And then it's very necessary for you to present early if you have abnormal reports. That is not the time for you to disappear. That is not the time for you to seek other alternatives that have not been verified to actually be effective. So it is in your best interest to go for these screenings, because it's only when you screen that you can detect early. So early detection is very key. For instance, in cervical cancer, if you do your cervical screenings and your pap smear results is not looking good, before it advances into full-blown cancer, when it is still starting with the earliest changes that we call CIN, you are able to do something about it. It's very necessary that you kickstart your treatment and your management immediately. Specialists are available. They are called oncologists that are in charge of cancer-related cases. Those are the people that you should go to see. Those are the best professionals who have been trained in that field to assist with cancer management. And for all cancer survivors, please stay healthy. We thank God you made it through. So eat healthy, don't let down your guard, keep exercising, make sure you stay away from too much processed food, avoid too much of artificial products, and I'm sure everything will be fine.
And not to allow fear take their lives before the treatment.
Absolutely. And don't let fear stop you from taking your tests.
Exactly. Knowing that it's from the mindset.
Yes, they dread the
really.
findings of the doctor and they completely avoid the screenings, which make matters worse. And people present now in advanced cases.
That's very correct. So finally, before we go, Dr. Charles, if you had just 1 minute with everyone watching, what's that one truth about healthcare in Nigeria that could change how we all engage the system? I mean, what would you tell them?
I'll tell you that first and foremost, your good health starts with you. It is your decision, it is in your hands, and it is all about you because it is your life. So all you need to do first and foremost is to make sure that you take responsibility for your health. Good health will not drop on your laps. You have a functional role to play.
Good health will not drop on your lap.
Yeah, it won't just
Profound.
happen. It won't just happen. It won't happen. So it has to start with your choices, your diet, your lifestyle. Quit detrimental lifestyle or habits that you have. Reduce your smoking or stop smoking preferably, and then your drinking should be restricted. Exercise, get enough sleep, stress management, eat healthy. All these are basic stuff that we can do to improve our well-being. And ultimately, if you have anything going wrong with you, please go and see your doctor. And don't even wait for anything to be wrong. We've said it time and time again. Go for your routine screenings. This is the beginning of a new year. Start your new year on a good note. Go for an appropriate screening that is suitable for your age bracket. And let a doctor examine you so that at least early detection will be able to help you to correct any anomalies that may be detected on time. So you see, your good health is absolutely your choice. So you have a good role to play in ensuring that you live long and you have a good quality of life.
Exactly. But I try to put myself in your shoes sometimes, what it felt like or what it should feel like to be a doctor. And I feel like we emphasize or we focus a lot on victims. We focus a lot on the patients and we don't really pay attention to the doctors. So for the doctors who are overwhelmed there, the doctors who feel overworked, the doctors who feel like there is so much demand on them and they cannot do more than their strength. What would you say? They cannot kill themselves. What would you say to them? Literally, I just wanted to encourage them as someone who is also experiencing something like that.
We see you. We appreciate you.
Yeah.
We love you for what you do. We hope that things get better.
Yeah.
And we hope that, the system appreciates you more and that everything you need to give your best, is made available to you. We see your passion for the job because if we're not passionate, you won't even be in that profession in the first instance. So you are special people, you are gifted people, and you are here to save lives. So we appreciate you, we see you, and we validate your concerns. Your concerns are valid. And we hope that the government does the needful.
Yes. All right, doctors out there watching this, we want to let you know that we see you, we value what you do, and we appreciate you. And we pray that you always be strengthened. Thank you so much, Dr. Charles.
Thanks
this was a really amazing conversation. And today's conversation really reminds us that the crisis in Nigeria's healthcare system did not start today. For years, patients have been suffering quietly. For years, doctors have been working under crushing conditions. Both realities exist, really. But if we truly want safer hospitals, we have to fix systems, not just blame individuals and talk about it. We just keep going around in circles. We must protect patients and we must also support the health workers. It goes both ways. And because no one should lose their life simply because help did not come on time. It's really sad. So our viewers, remember this. Your health matters. Your voice matters. And seeking medical care should never feel like a gamble. You can catch this episode again on SLTV, channel 264, or stream it anytime on YouTube at UPTV Live. Remember, take care of your body, listen to it, and stay informed. Because good health is truly your most valuable asset. I am Praise Peters, and this has been Health Check. Until next week, when we'll bring you another interesting and informative episode, please stay healthy, stay informed, and stay intentional. Bye for now.